Hello, everyone. I'm Bolanhal Gumbaya from the University of Kentucky, and we're at ACC 17. We have with us today at the Feet on the Go Lounge Dr. Clyde Yancy, who's the Dean of Diversity and Inclusion at the Feinberg School of Medicine, Northwestern University. You're very welcome, sir.
Thanks for letting me be here. I'm happy to be with you.
Thank you very much for honoring our invitation, and we're very honored to have you. As an accomplished researcher, as well as a clinician, what advice or insights do you have for fellows in training on how to have a perfect balance between research and clinical practice?
Well, Balahan, I think the first thing we have to talk about is the phenotype of the fellows in training. This is a very unique group of people with which you are aligned. Our cardiology fellows now are better than they've ever been before. They come to us with more skills. Many come to us having already accomplished certain research objectives. Many of them come to us with fantastic entrepreneurial ideas. It's an exciting time to engage with the fellows in training because the in-training doesn't exactly capture the increasing level of sophistication that the fellows bring. And that's what excites me as a chief of cardiology. And so part of the response to your question is that whereas in the past we could really lay out a strategy unique at every threshold for every fellow, now we have to be more flexible, more facile, because the talent that you and your peers bring to us is uniquely more considerable than it happened to be years ago. And the talents that you all have are uniquely different amongst yourselves. And so it's fascinating, and it's an opportunity for us to match talent and opportunity like we've never done it before.
Thank you very much, Mr. Yancy, for that very incredible insight into this very complex dilemma that fellows in training usually face.
But I wouldn't call it a dilemma. I wouldn't hardly call it that. It's an opportunity because as you recognize your own skill sets, then we have the resources in today's world to create a research path, a clinical training path that especially suits you. And so I wouldn't hardly call it a dilemma. This, again, is a fabulous time for you to be a fellow. There's nothing that is beyond your scope. You just simply have to identify what your level of interest is and what your level of preparedness is. And once we match preparedness, interest, and opportunity that we generate for you, I really do think that each of you has this incredible potential to be uniquely successful.
Thank you very much, Dr. Yancy. Also, knowing that you're the chief of cardiology at the Feinberg School of Medicine, Northwestern University, would you be able to kind of lead us into some of the bottlenecks that you would expect fellows in training to face as they try to strike this balance?
So once again, I'm going to suggest that we frame this differently because certainly there are choices that have to be made, and certainly there are challenges in terms of time apportionment for the clinical experience and for the research experience, but it shouldn't be framed in a way that says it's insurmountable. This is this golden moment in your career where you have the right once more to be a student, and you can access information like never before. You can create learning opportunities like never before. You can create research opportunities like never before. So if I were you and your peers, anyone who views the intersection of the clinical experience and the research experience as a bottleneck, I'd rather them look at it more as a flower. That is to say that there are any number of things you can do from a single strong stalk, your foundation. And if your foundation is a passion to be successful, appropriate preparedness, which is inevitable given that you're a cardiology fellow, then look at all the different pathways you can go. I think we finally have come to a point where not everyone has to do everything. And there will be some fellows where being an expert clinician is exactly what they want to do. It's the gift they have to give medicine and society. and it's the way in which they've been prepared, so we should enable that. But the same thing for the basic investigator, for the outcomes scientist, for the clinician scientist. We should make those things happen. So I wouldn't think about dilemmas and bottlenecks because they necessarily imply that there's a problem. I would really think about it more as choices, opportunities, maybe some challenges, that's fair, but challenges are simply opportunities yet to be dealt with. So I would think about it very much with a positive spin.
Thank you very much, Dr. Yancy. For more videos, you can go to youtube.com/feetsonthego.